Hey, this is Dr. Brandt Green with Neuropathy Partners, and I've been working with patients for years now in areas of physical medicine, non-drug, non-surgical pain management and rehab, and one of those areas is peripheral neuropathy. Now, peripheral neuropathy up until recently has been mainly a management style treatment where we're just trying to manage the symptoms with drugs, surgery, diet, nutrition changes, etc. Until now. I've got an amazing product that can't wait to show you that not only helps treat the symptoms, but actually gets in and starts helping repair the tissue at the core. I can't wait to tell you more. Peripheral neuropathy is when someone experiences pain, tingling, burning, numbness or weakness in the hands or the feet. And this is commonly associated with conditions like diabetic neuropathy or diabetes. It can also be associated with other autoimmune diseases, and it's really commonly associated with chemotherapy, associated with cancer treatments. And what ends up happening that causes these symptoms is we get damage to the nerves themselves, and then we also get damage and breakdown of the blood vessels in the area, and we have a result of decreased circulation. And the reason why that's so damaging and why that's such a problem is because as that circulation goes away and that nerve function starts to break down and die, not only do we lose, we get these tingles, this numbness, this weakness, but we can also risk falling and injury. And then that lack of circulation can over time cause even more issues that result in cell death and damage. And so the common treatments that have been available for years now have all been geared towards medication and medication management. And those only treat the symptoms. They're not actually getting in there and fixing anything. They're just managing the symptoms. And then the other options are looking at more invasive and more painful surgeries, which again, don't actually get to the core of the issue. And so what are we left with? What other options do we have? Well, if we think about it, the problem at the core of all of this is we are not getting enough nitric oxide into the tissues. So those conditions that we just talked about, so things like diabetes and chemotherapy and autoimmune diseases, we're losing nitric oxide production at the tissue level. And if we can get in there and produce more nitric oxide, as a result, we're going to get more blood vessel growth. We're going to get what's called angiogenesis. We're also going to get a decrease in inflammation. We're going to get a decrease in pain. We know that nitric oxide has a positive impact on the brain as a feel-good, much like the same pathway that morphine uses and dopamine uses. So you actually get this, when you get nitric oxide production in the body, you feel better, you get decreased inflammation, which is pain, redness, swelling, burning. You actually get the angiogenesis production or blood vessel growth and repair. And all of those things are what we want, right? So what can we use or what can we do to get that local production of nitric oxide? Well, it's right here in front of me. This is a product, this is a light therapy product. This is called Anodyne therapy technology. And what it is, it's a light therapy product that emits a very specific wavelength of light at 890 nanometers. And that wavelength stimulates the local release of nitric oxide and microcirculation. And there's also that nice little bit of warmth that comes off of the light as well that also produces that symptomatic relief. And so this product is absolutely amazing. I know it kind of sounds too good to be true offhand, that it can actually get in there and cause an acute relief and make you feel better right away, and then have a long-lasting effect that actually is going to help regrow and repair tissue. I'm sure a lot of you are thinking, does this actually work? Is this technology real, and how available is it? Well, I'm here to tell you it is real, it does work, and it does get results. 97% of 4,000 patients reported improved sensation. The average sensory improvement was at 65%. 92% of patients experienced reductions in pain, with an average reduction of about 60%. 90% of patients reported reduced fall risk. The average balance improvement at 85% improvement. So that's showing us that patients that use this product and using this technology are experiencing improved balance, fewer falls, significant reductions in pain, and overall improved activities of daily living, and they're able to live their lives. So how many of you out there watching this or listening to this can now see how this technology, this product right here, could work for you? It's getting pretty exciting, right? I am super excited to show you a little bit more. I want to actually show you how simple it is to use this technology because as advanced as it is, it's really, really simple to use. So I'm actually going to demonstrate how to put it on and how to turn it on. All right, so we're here with our patient, Mary Beth, And we're going to do a quick fitting and kind of show you exactly how to put on the technology, how to put on the boot. And it's pretty simple, so we'll just follow along. Just a heads up, the plug-in, right, the power source for this is just a standard outlet. So you just plug it into any home outlet and you're good to go. And it's actually just a single switch that operates the unit. So it's really, really easy to use. And so we're just going to go ahead and get started. Now the piece of equipment itself, as you can see here, it's very, very high quality. It's made really well. The Velcro and the straps, the nylon here, is flexible and elastic, so it'll fit a large variety of patients. From, if you've got some really small legs, it's going to fit well. If you've got larger legs, it's still going to fit really well and comfortable. And the neoprene on the inside makes it really comfortable and sweat-proof, easy to clean. So there's a lot of benefits to the technology. A lot of time and effort went into designing this specific type of product, right? So we're going to go ahead and start by putting on the leg unit first. So we have two pieces here. We have a foot and a lower leg. So this is going to go on the calf, on the back here. And then this product here is actually going to go on the foot. Okay? You could absolutely use this product on the thigh. You could use it if you had neuropathy on your arm or in your hands and your shoulders. You can absolutely adapt these products, but this specific unit that I'm using right here is geared towards the foot and the lower leg. Okay? So we'll start with the lower leg piece here. And as you can see, we look at the inside of this product, and you can see there's a little bit of a kind of a cutout here. This is going to go down towards the lower part of the leg, and this is going to go up on the calf. Okay, so we're just going to have her slide her foot through there, up onto the calf. And ideally, you're placing this where you're experiencing the symptoms, right? And so the way that this works, when you get this, it's going to be two straps. You feed one strap through the other hole, and then you're just going to cinch it across with a little bit of a stretch. And then the more you use it, the more you wear it, this is going to start to mold to the shape of your leg. But all of it is set up so you can wrap these straps as far around as you need to and as tight as you need to get a nice secure fit. And then again, the lower portion, you do the same, make adjustments. All right, is that comfortable? Mm-hmm. Perfect. All right, so we're going to go on to the foot unit. And now this one looks a little tricky, but it's really simple once you get the hang of it. So it's going to come just like that. This strap here actually goes around the back of the leg, the back of the heel, right? So it's going to wear almost like a sandal. And so we're just going to slide her foot in here. And we're going to get the lights or the diodes all the way to the back of her heel as far as we can. And then we're going to just wrap this strap around the heel and attach it right here on the Velcro. We do have adjustments here as well if we need to make adjustments. And that's it. So now she can get comfortable, she could lay down, she could be on her couch, she could be in her chair, and just hang out and get a very, very high quality treatment that's going to help stimulate that nitric oxide production, help stimulate microcirculation, put off a little bit of heat so she's going to feel good while she's getting this therapy. Therapy sessions are about 30 minutes, so you want to spend about 30 minutes with that light product on. If you are experiencing a lot of symptoms, if your pain levels are high, if you're experiencing a lot of neuropathy, or you've had this if you've had the condition for a really long period of time, you may benefit from doing this treatment twice a day. And you can do this daily. You can't actually do it too much. You can do it as often as you need to. We are going to give you some protocols. So anybody that gets this product, we're actually going to have products and resources available that are going to walk you through the exact protocols that you need to do for home. And this in conjunction with some therapy, some exercise, stretching, good diet, you're going to have far, far better outcome than you are with those traditional options of just resorting to prescription medications and surgery. So that's it for now, and hope you enjoyed. If you have questions, feel free to reach out, and we'll talk to you soon.